Hello, hello, hello. Hi, how are you guys? Good evening, good evening, good evening, good night, or good morning, depends on where you are in the world. My name is Abby Tyler, Abigail Tyler, for those who know me formally, and I am the administrator of this forum. As you can see, my name up there. I usually do this on my regular forum, my health forum, Abby Tyler's Healthy Living Group. Doing this now to reach a wider audience. So tonight I'm going to be speaking on breast cancer awareness. Breast cancer is something that is very prevalent in our community. I'm going to be speaking to Liberian community, African community, Black American, and Americans as a whole. So it's not just to one person. But in case if you see me segue into one particular group, that's the reason, because I'm trying to reach people who are harder to reach. Again, like I said, my name is Abigail. For those of you who don't know me, I am a family nurse practitioner. I practice in a private practice in Philadelphia. And prior to that, I was a nurse, cardiac nurse for 20 years, and I did long-term care also for 2 years prior to that. I'm a graduate of Drexel University, and I'm going to be talking about breast cancer. Like I said, this is not all encompassing, so in case if I leave anything out, I'm not saying everything on there. And disclaimer, quick disclaimer, everything I say here today is for informational purposes only. All my information is coming from what we were taught in school, for our own practice, and also from the American Cancer Society page, and also United States Preventative Task Force. Okay, so I'm just going to wait a few minutes as I share this on another page, because I just forgot that. So just give me a few minutes. In the meantime, I'm just gonna if you see me looking this way, that's because I have my information written here. Okay. So we'll be talking about breast cancer and are you at risk. For those of you who will be joining me now, I say thank you. For those of you who will be joining me later, I say thank you as well. And this is also going to be uploaded to YouTube under the same name, Abby Tyler's Healthy Living, on YouTube later on tonight or tomorrow. So please excuse me. I'm just gonna just do this for a second. And because I'm doing this on 2 pages now, so I'm just gonna go in here and share this video. If you can you please also share the video? That was one of the main reasons I decided to get a public page too, because I couldn't share the video from my page. So let me just see here. I'm making sure that I'm live on my other device so I can be doing this. At first I'm on a public page, so well, by myself. So I'm still trying to get myself here together. Okay, so let me just go in here. Sorry. On my other device. I'm just lowering that. That's my thing there. Okay, so I'm gonna do this here. Post. And alrighty, I'm gonna go in here and move this up a little bit. And I see one person's joining me, so I don't want to lose my thing here, so I hope I don't. I can't. This is all new for me, so trying to share it, but I shared this on my page as well. So, but anyways, for those of you who in Abby Tyler's Healthy Living group, I am gonna try to get that there as soon as I can. But I don't want to waste any time, because I do want this to be at least no more than 30 minutes, and I've been talking for about 4 minutes now. And please forgive me if I speak a little fast. I'm naturally a fast speaker, so I'm going to try to slow down a little bit. Okay, so breast cancer. Going back to the topic here, for breast cancer, 1 in every 8 women would be diagnosed with breast cancer in her lifetime. So think about it. You say, okay, I know eight women, including yourself. Count people that you know and people that you love, or just people that you know. Just count. Say at least one person, one of them would be diagnosed with breast cancer in their lifetime. So are you at risk? Now, for most people, they're not, it's like, okay, I don't have any family history. Most of the people who are diagnosed, like I said, 1 in 8 would be diagnosed with breast cancer this year. But 80% of those people who get diagnosed with breast cancer have no family history. But still, the mainstay of those who would get diagnosed with breast cancer are people who have family history of it. So let me go in there and talk about your risk factors. So like I said, sometimes your risk factor is only simply by being a woman. That's it. Because a lot of people who I know who have become had breast cancer in the past, had no family history. I had friends, I have very young friends and older people too who had no family history. So, your risk factors, let me just read a brief history there. A family history of breast cancer is the most widely recognized risk factor for breast cancer. Like I said, most people, that's what we look at from a provider point of view. The lifetime risk is up to 4 times higher if the mother and sister are affected, and it's about 5 times greater in women who have two or more first degree relatives with breast cancer. First degree relatives would be your mother, a sibling, female sibling. And men can also get breast cancer too, so it's not something that's totally limited to just women, but women are more primarily affected with it than men. The risk is also greater among women with breast cancer in a single first degree relative, particularly if that relative was diagnosed at an early age, meaning anything less than 50, because breast cancer usually come for older people, but usually you can get it also. I have friends that I had last year, like 3 of them were less than age 40 and they all had aggressive breast cancer. So going years. Like I said, again, if you're risk, if you bring a female, women are more likely to get breast cancer than men. With increasing age, anything greater than 40, that's when you did to 40, 45. The guidelines are down to 49 to start getting your mammogram. Personal history of breast cancer, breast conditions, if you had any issues there before that they did a biopsy, that they saw anything else atypical in the past, that's a higher risk. Personal history of breast cancer. Of course, if you have breast cancer in one breast, you're going to be able to, is higher the chance that you're going to get it in the other breast later. Family history of breast cancer, like I said before, especially if somebody was diagnosed prior to age 50. If you have an inherited genes, there are other genes, the BRCA genes, that if you have that, so usually if you have a family member that was diagnosed very young in life, you want to tell your family member or friends or somebody related to genetically so they can get tested too, because once that gene runs into the family, there's a higher chance that you may get the breast cancer. If you had any radiation exposure before, let's say if you had anything going on before that you had radiation therapy prior to when you were younger in life. Obesity, the same people who are obese have a higher chance of getting it, maybe because you're not eating healthy and you're not exercising. All of that plays into that too. Beginning your period at a younger age. Usually the median age for getting your period is about 10 to 11. So if you get it younger than that, some women got their period when they were like 8 to 9. Of course, that's not something you can help. So, but usually, when you tell your provider that, they kind of keep an eye on you. If you begin your menopause at an older age, usually at an older age, usually you start being perimenopausal, meaning you start going into the stage where you become in menopause and starting to get menopausal symptoms at about age 45. And then you go on to like age 50. Usually menopause is not until you have one complete year of no periods whatsoever, no periods for a whole year, consecutive months, 12 months of, that's when you have your menopause. But for some people, they still see their menstrual cycle up until like 55, 56. So usually that also is a high risk. Also, having your first child at an older age, I guess it's because you're not releasing all the hormones and all that from getting pregnant early. Because way back in the day, people had a baby when they were like in 15, 13, 15, right after they started period. That was way thousands of years ago. So usually they tell you have your children early on in life, so you don't run into any kind of complications later. Having never been pregnant, I guess it's the more every time because when you don't get pregnant for a period there where you for like 9 months, when you do get pregnant, you're not putting out the same kind of hormones. But if you never get pregnant, so you never put out those, you just continuously put out those hormones, that also puts you at a greater risk. And for those who postmenopausal hormonal therapy. Like for people who are getting medication, some people go through menopause and they have so many symptoms that they cannot, it really affects their lives, and doctors put them on menopausal, they put them on therapy, hormone therapy. Usually when you get on hormone therapy, by the way, you're supposed to be there for no more than 3 to 5 years, and then they take a break and start. And some people, they don't get that any benefit from it, or some people it's not, they don't meet the criteria. But once you get on that, you're not supposed to be on it for much longer than that, and if you are, that can also affect you. So some people just, that's just the way it is. So those are the risk factors that we look at. You want to ask your doctor So beginning at age, they recommend beginning at age 40, like I said, depending on your medical history. Like once again, I'm going back to the fact that you have to speak to your doctor, talk to your personal doctor or provider and let them know, and they can determine what your personal risk is if they should start at age 40 or start at age 45. But right now in the guidelines is like 40 to 45. So I'm gonna go back here. So they say, okay, women with average age of breast cancer should undergo regular screening mammography starting at age 45. So meaning that you have no family history whatsoever, even though we already been back to the fact that, just being a woman can make you a high risk. But with average age, they say begin at age 45. Women 40 to 54 years of age should be screened annually. So every year you want to make sure you get screened annually. Women greater than 55, she can transition to biannual screening or have the opportunity to continue screening annually. Again, your personal doctor, if you haven't had any issues prior to that, your doctor can determine whether you should go ahead and be doing it biannually. But of course, if you have any issues, you want to make sure you tell your doctor. But most doctors are so comfortable with saying, you know what, just continue doing it yearly, and we'll just go with that. Women should continue screening the mammography as long as their overall health is good and they have a life expectancy greater than 10 years. Like, if you're 95 years old, you're not going to be doing a mammogram because normally people don't live past 110 or 100. So don't no sense in putting somebody that much older and if they're not healthy into things like that. So those are the risk factors there. So we're talking about, so when do you get your mammogram? And when you're going to go get your mammogram, I know they tell you make sure when you take your bath the night before, the day of, don't put any lotion on, don't put any roll on nothing because you don't want any particles from the lotion or any particles from your everything else to show on the mammogram because it's so powerful that any little thing you don't want something that could be a cancerous to come across as being just lotion or any kind of if you antiperspirant or deodorant. So we're just going to go up here. So ask your doctor about your risk factor. Make sure you have these conversations as you start getting to that age. And your doctor will tell you that when you go for your yearly appointment, they're going to talk to you as a woman. They're going to talk to you, get to age 45. They start talking about colon cancer screening and talking about mammography. And also the way actually, plus we have your history and we have everything that's, say, okay, yes, when you came, we took this and all that too. And then every time you come back, we review it and make sure that we're setting you up to go for your mammogram. Alrighty, so self breast examination is still the most what even though that some doctors there's still questions about, okay, well, some people feel something and they don't know what they're feeling and they may think that they have breast cancer and sometimes they may miss something and say maybe that's not it. So but still you want to do it every month and you want to do it a week after your period, not doing that before because your breasts are engorged, your hormones and everything running all through your body. So you want to make sure that you're doing that like a week after your period, whenever your hormones are a little lower in your body and your breasts are back to where they need to be. You can go ahead and do that. Okay. Some of the signs and symptoms you want to look for: any change in your breast size or shape. I mean, there will always be one breast that's bigger than the other one, so that's normal for you. If that's normal for you, that's fine. But if you get concerned, bring it to your doctor's attention. Of course, you want to be going. You can also bring it to your primary care because we're also trained in looking at your breast and doing examination as well. But most of the time, we're going to be sending you to your OB/GYN. And then sometimes nowadays, it's like to make an appointment with the GYN, it takes longer because everything is so backlogged. And if you're not having any serious issues, nobody's going to not nobody's going to see you, but the waiting time would be a little longer. If you notice any dimpling in your breast, like if you look at your breast and you see like little dimples there that weren't there before, you want to make sure you bring that to your doctor's attention. Any kind of drainage, you're not supposed to have any drainage from your nipples, okay, and anything under your arm too, because people forget that your breast is also all part of this too. So I'm just going to move this camera down just a bit here. Alrighty. By the way, I don't have my glasses. I see it back there and I needed to read. So let me put it here. Okay. So when you're doing your breast exam, all right, you can do it laying down. You can do it standing up. You can do it in a shower. It's just as long as you have a view of your complete view of your breast. Okay. So like I said, you do and I was watching different shows and I'm so happy, by the way, I'm so happy so many librarian shows that were on this week and previous weeks I've been talking about breast cancer. This is something that, like I said, is prevalent in our community, prevalent in America as a whole, in the African community, and there's something we don't talk about. So I'm so happy to see other shows that have touched on this at the same time. And I've done so many shows about breast cancer in the past. I almost didn't want to do it this year, but I said, let me just put a little bit, let me come on and talk about it too, because I'll be coming to you as a provider. And I can give a little bit more information than what I've been doing in the past years. But once again, I'm so happy to see everybody, just about every talk show that we went on so far that has been on the past week or the previous week, have been talking about it. And I also went to other breast cancer event in the past in our community as well, because we had a couple of people who were affected that needed help. So like I said, okay, when you're doing your breast exam, once again, you want to do it a week after your period. For those of you who do not see your period, or you're probably on some contraception that you don't see your period every week, just make sure you know when you were supposed to be seeing your period before, and pick a week and do it. Usually when you don't see your period, you're still feeling engorgement in your breast if you're premenopausal. And those of you who are postmenopausal, just pick a week in the month and just do that the same week every time, and making sure you're not, just because you're older than me, you can't do it. Okay, so you want to make sure that, like I said, if I was doing your breast exam, you came to the office, I was doing your breast exam, you want to make sure it's not your whole hand. Okay, you're doing your fingers, you're doing like two fingers, and you're going to be going straight underneath here and going, making all the way circular. Make sure you don't have your bra on at the time, and make sure it's you doing it, not a partner, somebody doing that and you playing around. You want to make sure you're doing that with that. Okay, make you doing it the way it should be done. And you're going to be going around, go in your fingers, and this camera is doing it backwards. So you go in your fingers and you go in all the way around. You're going to work all the way around, completely with your fingers, because you have to be able to feel if there's any kind of lump, very tiny lump. It has to be like really hard, and it can be moving back and forth. So you have to do that, do it clockwork. You do it back and forth, back and forth. You're feeling with your fingers like that all the way until you get all the way to the nipple lining. Okay, your areola, the darkened part of your breast. You go ahead and you do that, and you do that until you get to your nipple. Okay, you take your nipple and you squeeze, and there should be no drainage coming out there. And you also want to make sure these are all back here, your lymph nodes. These are all your breast tissue, all the way back here under your arm. So it's not just your breast here. You're doing everything that's all the way underneath it. You're feeling here, and you're doing that. Okay, and then you want to make sure, like I said, you take your clothes off, you look in the mirror, look at the size of your breast. One breast will always be a little bigger than another. And those of you who also have breast implants and all, you can still do this, but it's going to be a little harder because it kind of covers some of the breast tissue. And you make sure you're doing that, but because don't just do this, because you're not going to feel anything. You got to make sure you're doing your fingers all the way, and put your hand back here so you can feel that, because when you do go for the mammogram, your arms are going to be back here when they do that. Okay, this is all part of your breast tissue all the way down here. So sometimes people don't feel under the arm, go there. So you do that, and do that at least like I said, every month, for 1 week after your period. So when your hormones are down in your body, you go ahead and do that. Even if you're pregnant, still go ahead, because your breasts are going to be engorged anyway most of your pregnancy. So, but you still want to do that every month as well, because you can still get pregnant. You can still get breast cancer while you're pregnant. And the thing about it is, like, when you getting breast cancer prior to age 50, sadly, because your body is still putting out hormones and everything, the prognosis is sometimes kind of poor, but that doesn't always mean that going to be like, just that most times when they do the studies and all, people who, because when you're still seeing your period, like, again, I say your body's working with the hormones. So I think I had this in my forum where I talked about your endocrine system that controls all your hormones in your body. They tell you, okay, let's go, we get every month, the female body wants to get pregnant every month. That's it. That's all it wants. The reproductive system is set up to, like, get pregnant every month from age 11, whenever you get your menstrual cycle, to when you finally get when you finally get to menopause. So every month the brain, and it tells, okay, let's go, let's get the womb ready, which is your uterus. Let's get the body ready to go ahead and have this baby. And then nothing happens, and then you have your period. So it's still going, your body's still working with the hormones. So that's what happens when you do get breast cancer prior to finishing up your getting to menopause. It can be a little bit more complicated, and the treatment also will be a little bit more complicated, because some people still they want to have children. And whatever radiation and chemotherapy and all that can be a little bit more complicated. Of course, they're going to tailor it to according to what your life and all, but still. And for those of you who are watching Abby Tyler's Healthy Living group, I'm so sorry. I was trying to put this there, but some reason I can't get it. And I'm not looking at my phone. So if there's anything that you have to talk to me about, I'll just look here for a second. Alrighty, 1 second. I didn't even need to right there. Okay. So she's uh so like I said, okay, so you do that so when you do get breast cancer prior to, most people end up having to have like longer treatment and more complicated treatment. And then also if you want to have children later, you still have to be in the medication for a while, and they tell you not to get pregnant in that time. And also sometimes they have to like, take out your eggs and that can be a little bit, very expensive. So you want to make sure that, like I said, if you don't feel anything anyways, and you just concerned, you say, you know what, I'm just concerned. I'm really, really worried. Talk to your doctor. There's a screening mammogram. The first screening mammogram is the one, just a basic mammogram. But if you have a family history, like I said, for those of you who were diagnosed with family member that were diagnosed prior to age 50, that makes you a higher risk. So they'll probably do the digital mammogram and also follow with the ultrasound. So because the mammogram is very, very effective at finding it, but at the same time, sometimes they'll say, okay, we see something that we're not too sure of. Can you please we'll tell you to come back in a 3 month interval, or we'll tell you to come back 6 months, or we'll just refer you right away to your surgeon. We'll go back to your GYN. They'll explain the GYN or the family doctor. We get the report as well. We send you a report, and then they send us a report too. So we look at it, and when we get you back in the office, we can discuss this. So this is what we're looking at. They're saying that they see something, if there's no other prior films, so you haven't had mammogram prior to that, and they see something that they're not comfortable with and that looks abnormal. It may be nothing. It may be just something like a cyst, but they want to test it again. And so when we do tell you that, please make sure that you follow up, because if you do have cancer in your breast, or you do have something going on there, it's not just going to go away. Is I believe in prayer, I believe in miracles and all that, and sometimes people, it works, but don't just rely. God will tell you that He gave these people who are in the health field and all that, He gave them the brain to be able to like, take the technology and tell you what to do. So make sure that you can still pray, but you can still follow up as well. So like I said, you do the self-examination, you watch your breast, you go there and follow up with the screening mammogram. Most people will tell you mammogram and then follow up with the ultrasound, and then they can go to like the 3D, and then the other one where literally it's like they put the gel on you and it kind of almost like iron down your breast. I've had that too. So people ask, so is mammogram painful? It's not so much because it doesn't even really last long. Like the first couple of times you have it, you go in there and you're having the breast done. You take your blouse off, they put you in the machine, they squeeze really hard because they have to be able to like get down and make it almost like, and so it can be a little uncomfortable. I'm not gonna lie, it can be a little uncomfortable, but before you know it, like 5 to 10 minutes later, you're done. So, and 10 minutes meaning the fact that they have to position you and tell you to stay in this way and make sure they position you right so they can get all your breast tissue, and like I said, all back here too, because most people don't know that your breast tissue is all in your lymph nodes, and also they have to look all the way back there. Okay, so the ways that you can, they say the ways you can prevent it, but you eat healthy. Most of the thing, eat healthy. Let me just over here. Okay, you can eat healthy, making sure that you're not staying in healthy weight, because like I said, also your risk factors, obesity. Tell your doctor, look at the medication you're taking, take medications that you only have to take. Don't take anything that you're not supposed to be taking. And most of it, because it said what the guidelines is, and there's still studies are still ongoing every day. When people say, oh, you tell me something today and then tomorrow you're telling me something different. No, there's research ongoing every time. So when something come up and that's different, doesn't mean that they're lying to you or they're just changing things around. It just means that new research came and now that's what they're looking at. So and also when you go for your breast, you go for your mammogram, people have the really dense breast. It's the breast tissue, your glandular, your milk ducts and everything. So if the more dense your breasts are, the higher the risk, because the mammogram cannot see through definitively cannot see through a really dense breast. So there are different levels, and then when you get your mammogram report in the mail, the first thing they'll tell you is negative, no suspicious findings, and then they'll tell you this disclaimer below there that your breasts are very dense, and having really breast and dense breasts is not something that's like not uncommon. A lot of women have really dense breasts, but there's like levels of breast density. They will tell you level one, level two, level three, and then also the BIRAD course score too, where it's like from 1 to 4, tell you the chances of you getting breast cancer in your lifetime. So when you go to your doctor, when you get the results back in the minutes, most people just look at negative and like, thank God, but then you also want to read a disclaimer there to tell you have really dense breasts. This is your breast density score, and also your BIRAD, BI, then RAD. Look at the score too and say this is the chances of you getting breast cancer in the future. This is the percentage of that. Doesn't mean that you breast cancer is inevitable. It just tells you where it is that your starting point, and that means your doctor sees that and they'll tell you, okay, we have to have a digital breast examination or uh, mammography, and then also follow with ultrasound. Also, sometimes you have to follow with an MRI. So all those things, because they'll be like, well, how come if the mammogram is not affected, and why should I use it? Yes, it is. It's the best. This I mean, the guidelines that we start off with, and then we move on from there. Okay, because you don't want somebody saying, oh yes, feel something in my breast. Oh, let's go do a biopsy. No, no. You don't want people just doing stuff on you when there's no reason to. So we'll follow up. We'll do the imaging first, and then we follow up with anything. Usually, if they find anything first, they'll do additional testing, and then they'll probably go with a needle biopsy, where they just go in there, take the needle, a little bit numb the area, take tissue out, send it to the lab. They'll check it out. If there's something else they need to do, they might open you up a little bit, take some more tissue, and do that. And then later on, if they say, okay, there's something else that we see that we need to go inside and operate, and then they'll tell you. Then you'll go through with that. Okay, so but like I said, eat healthy, and sometimes it's just ways to prevent it. I mean, environment, there's so much what you can do in environment, because sometimes you can live somewhere that's like really safe and all that, and there's like a lot of radiation in the air. People who live close to factories and all that, kind of work that you do that would make you higher risk of getting it. So you want to make sure you do that. Low cost. Most people say, okay, yeah, we'll do the mammogram. We get the breast cancer thing, we get the breast cancer thing, but it's expensive. Especially the screening mammogram. It's like, start like anywhere from like 100 to 250 dollars, and most people don't have that, especially people who are poor, and people who are like not only just poor, but you're working from paycheck to paycheck, which most of us are. And you may have some spare money, but you're thinking, do I take that money and do that, or do I take that money and really pay it, do something that my kids may need something, because I may need to pay a bill. So do I want to take that money, and if they didn't find anything last year, why should I take that money and go do that? Which is, and sometimes people have to make really real life issues. I have patients sometimes where it's like, okay, do I need to buy that medication, or can I just take that medication, break it in half, and it's like, no, you can't do that. You have to take the whole medication. But people have real life issues that it's not just a luxury to just go ahead and get a mammogram. So for those who have affordable health, affordable Obamacare, you can get your mammogram free of charge every 2 years starting at age 40. Most healthcare plans, you can get your mammogram like basically no copay, because it's one of the things where the screening thing, like I talked about in another visit, in another video prior to this. You can get part of the screening thing, and they'll pay for things that are screening, but that's like the basic screening mammogram. Anything digital and all that too, you have to have insurance. And there's also Planned Parenthood. Planned Parenthood has so many different services that they do GYN care and also contraception. And also they have like waivers and referrals and all, where you can go and get like free mammogram. And also you can also get low cost mammogram. So it's very important. You don't want a whole section of the population to not get the mammogram because they can't afford it, and then come down with breast cancer, and which is more devastating and more expensive. So there are many community health clinics in Pennsylvania. I'm talking about Pennsylvania, and lots. If you live in the Philadelphia area, there are lots of them in there, and also in the suburbs, so they have different clinics. But even those places, if they don't provide it, they have the social service. They have, and different hospitals have social service departments too, where they can give you information where you can go to and get a really low cost mammogram. The Susan G. Komen, Komen. They do a lot of outreach, so you can call them and call that number, and they can give you where they'll be providing free or low cost mammogram to wherever it is you live in America. So I don't know too much about outside of America, but they do that. So So there's no reason, not there's no reason, but for most people can afford it. And that was one of the part I wanted to add to this, that you make sure that I want to make sure I speak to people who cannot afford it and how they can get the help that they need, as with any other um, care that I give. So it's about 29 minutes now, and I didn't want to speak too long because I know people get a little antsy when things talk. And like I said, a lot of people have been talking about breast cancer recently. So my final thoughts is, making sure that you go into your that you following up with your doctor, you go into your yearly visit, making sure that you're getting your yearly mammogram, making sure that if you say, okay, you know what, I don't really know how to do my breast exam, I see people talking about it online, but I don't know how to do it myself. You can, if you come to, like you say, if you're coming to my office, to my practice and all that, I'll show you how to do it. Like I said, will show you how to do it on people too, when they come to the office for some other reason and they need to check. I check that too, but I always say, that's a self breast examination. Just because you don't feel anything, don't do it. And I'll tell you the personal story too before I go. In my early 30s, I remember I was having some chest pain. And I remember talking to my cardiologist, one of the doctors that I worked with at the time. And I said, oh my God, I had chest pain. And she said, well, it could be chest pain and it could be cardiac related, because she just had a baby. And then also, if you could be the fact that you probably have asthma. I said, I don't think I ever had asthma symptoms. She said that, or it could also be like you could be breast cancer. So, because the thing about certain diseases, there's so many symptoms that mimic other diseases. So that's what we call like differential diagnosis, where it could be like, okay, we're working on this one, working on this one, working on this one, and try to rule out the most pressing one, the one with higher priority first. We try to take care of that first, and then we take care of the other ones. So I went ahead and got a cardiac workout, the EKG, the echocardiogram, and the stress test and everything that was negative. And I didn't never went for the asthma because I kept saying I did go for my asthma thing later on. But I said, okay, fine. I'm still young. I'll go do the mammogram. And the first time it was uncomfortable. So I went ahead and did it. And then they're like, okay, we see something there. Can you come back? And not being a nurse at the time, you're like, when they start telling you to come back for stuff, it's like you start getting worried about it. And I'm like, I don't have anybody in my family that has it, but I don't know anybody on I don't know my father's history either because my parents divorced when I was young. So I don't know and he was older, so they probably wouldn't have said anything in Liberia anyways. So we had to go back for two more, and then I had to go back to do the needle biopsy. And then I went ahead and they said, okay, let's go again because we can tell. It's like there was no way, I don't care how many breast examination I did, there's no way I could feel what was there because it's like tiny, tiny calcification like this that was small, like a grain of sand. So like micro level and all. So they did the biopsy and everything, and then they went back in there and did the essential biopsy, like tiny little spot. So and then he was like, okay. And then I was worried and worried because I was pretty young. And like I said, the younger you are when you get any kind of symptoms or you get breast cancer, the recovery time is more complex and the prognosis is a little more complicated. Prognosis meaning long term, what it's going to be like long term. So, and then when there, it was a guy, my doctor who I work with. He was also one of the doctors I work with too, which was kind of strange because it's like I saw him, I'll see him today in the office, and then the next day we'll be on the floor together, and my coworkers used to be like, "Did he just see your boobs like yesterday?" And like, whatever. So, and if you work with people like that, don't be shy to ask questions. Make sure, because somebody be like, oh no, I think you should go take a look and see, make sure. So I went ahead, and luckily for me, it was negative. But because of that, so I've had breast and mammogram like every year. And there were times where like, I was like, I don't want to do this, I don't want to do this, because it was always mammogram followed by ultrasound. So what I do every year, I go for my mammogram and I sit there and I'm like, okay, please. And they'll tell you, go back in the office, go back in there and wait until we see if, we got the films correctly, we have to do any more films, or we have to do the ultrasound. So every time I'm like, every year I go there and I sit there and I'm like, okay, maybe no ultrasound. Maybe they'll just tell me I'm fine today. Maybe they'll just tell me I'm fine today. Maybe they'll just tell me I'm fine today. But like just about every other year was always, okay, we have to follow ultrasound. And I'm like, oh, and they're worried and worried. And then you sitting there and they're doing this test to you and you're looking at the technician's face because you're looking to see, do they see something? I mean, will she make her face? Was she, and you're sitting there. And as clinicians do, like when you see something or you're doing something with a patient, you try to have this poker face because you don't want to alarm the patient. So It's like, do they see anything? Do they see anything? And they'd be like, okay, we'll let and then like a week or so, you sit there and you're worried and you say, oh my goodness, please, you wait for your reading to come, because like I said, they send you a letter in the mail, and then they also send a letter to the doctor that prescribed it. So sometimes if it's your GYN, and then the copy also comes to your primary care physician. So you sit there and you wait for like for a week or so, and you worried and worried, and then you get your report and it says, it's been negative so far. You'd be like, so every year when I do it, and I go ahead and I leave from there and I get my negative results. I go ahead and I buy something nice and cute. And I'm like nice and pink. And I'm like, okay, another relief for this year and all. But then I also look at my mammogram. I look at it, like I said before. Make sure you're looking at your report and looking at your density level. Okay. He said, okay, let me see that in a reply to it. All right, let's go. Sorry, I'm distracted. So, you want to make sure that you look at your density level, and if you see and you want to talk to your doctor about it, you come to the doctor's office and say, I need you to just explain this to me a little bit more. I was watching, and I had somebody saying that this is the reason, this density level, my BIRAD score, can you please explain it to me? I've had to explain it to my patients before. I said, this is what it is. Sometimes I said they want to see something different, so you want to make sure you go ahead and do that. So I think that was my final thought. My final thought, make sure you do your breast exam. And it's never too early to get it, as soon as, I usually try to say maybe age 18, because, anything younger than that is still pediatrics, unless if they feel something deep. And just because you feel something doesn't mean it's cancer. If it's like real, and most of the time, if you feel something, it's not painful. Cancer doesn't come, it's not painful right away. When you start having pain, I mean, it's probably, the stage is a little more than just stage one. And that's when you start having pain, referred pain. And it could be, like I said, it could be chest pain, it could be something else, because everything, your lungs are in the area, your breast, your heart, and everything. So all of that, we try to make sure, but we do the mammogram, and then we have to send you back. We do the screening mammogram, and if we have to, we do the 3D, and then we can also do the MRI and all that. So please make sure that you eat healthy, follow up with everything you're doing. Let me just see here, because I'm looking at something else. Okay. Um, Excuse me. Okay. So I don't, if you have any other questions after this video is over, please just put that underneath there. I'm just gonna look here and see what look at some of the questions. I'm scheduled for my, yes, remember that. Good, okay. Thank you, Jackie, for watching, and thank you for everybody else who will be watching later. So please, 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 when I was watching another show, another Liberian talk show, and somebody said, "Oh, I went to get it." I think it was somebody who was affected with it. We were paying for her, and she was saying, she didn't think it was like mostly white people stuff. And surprisingly, a lot of people still think that. Oh, I don't think it doesn't, I don't think it's in the Black community that much. It's in the Liberian community. I don't know anybody who had it before. And I don't know if the health industry had, need to reach out more to minority communities, and also for minority clinicians, and also African clinicians to reach out more to the, but everything about it is so secretive. Nobody wants to tell anybody anything. It's almost like it's that person get cancer, and then it's something that they did, or it's something they did, God's punishing them for whatever, and that is not the case. That is not the case. Okay, people get cancer. I mean, would you say, oh yeah, you got a headache, God's punishing you? Like I said, I'm not I'm a religious person. I'm not that big a religious person. I know I have a relationship with God, and I have to practice within my guidelines of being a clinician. So I feel like, when I teach you stuff, I also say, go ahead and pray, do meditate, and do it. And all that too kind of helps with the anxiety of it, because you're praying or you're meditating, and your body sees that, and your body understands that, and it brings down your anxiety level, and you can think clearly. Also, when you're healthy and you're in the right state of mind, and if you're going through any kind of problem like the breast cancer or any kind of illness, that helps too, because it kind of lowers the level of your fight or flight. It lowers that, and you're able to heal better. Okay, because your body's not going to your mind's not going to mind, and meaning your heart is not beating too fast, your blood pressure is not up. You're just relaxing, saying, okay, people say, oh, I'm going to leave it with God, I'm going to leave it with the higher power, I'm going to leave it with the universe. That all just kind of, your body realizes that, and it just kind of calms you down and keeps you where you need to be. So if you have to face anything, you can face it and think clearly. So make sure, for those of you who have a lot of friends and support system too, and those of people who are going through this, making sure that if somebody's going through this, be there for them as much as you can. Doesn't mean you have to be all in a business if they don't want you to be in a business, but you can say, you know what, if you need something, if I can, please say, if you need something, if I can help you, I'll help you. Don't say anything you need, call me, because chances are more than likely you're not going to be able to be there at all times. And also, get your girlfriend, call this friend, call eight people, or call as many people as you can. Tell them, did you get your mammogram? Did you get your mammogram? Did you get a mammogram? If you click on there saying, those of you who will be watching this, if you want to comment in there, did you get your mammogram? Did you call your family member? Did you tell them to get the mammogram? Your mom, your sister, your cousins, the females, and for males also, if they tell you that, if you start feeling anything in your chest area, don't be embarrassed, because most men will be embarrassed, like, oh my God, this is something I don't want my men to know. Look, Beyonce's father, he came forward and he said it, and a lot of people were like, oh my God, I didn't know people could get breast cancer. But he came forward and he was able to help a lot of people who didn't know anything about it. And like I said, in our community, everything is hush, 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 hush. And that's not what you need. You need to be able to, like, do these things so you can get help. And if you do have it, if you're a sister, you have a sister or a female relative, you tell them, say, this is what I'm going through right now, and I'm just trying to let you know, because we share the same DNA. Doesn't mean you're going to have it, but this is where I am right now. And I heard my doctor said that if I do have it, and if I share DNA with other people, I should let them know. So, let's just go ahead and do that. And like I said, relax. Before it's like, oh, a different word. Relax, relate, release, just, and just take it. And it's not, it does get nerve-wracking, because every year when I go, I'm like, oh, like I said, you worry about it. You say, what are they going to find this year? What are they going to find this year? What are they going to find this year? And, it's just something, it's not something that we all want to run ahead and do, but it's something that we have to do. Okay. So I just saw my share button here, and I just learned it. Like I said, I'm just learning this. Okay. So thank you all for watching. For those of you who are watching now, thanks, my cousin's always watching. Thanks for that. And I hope I've been of some help. If I can help one person, even if it's just one person that said, yes, I was watching this other show, but I didn't get this information, or yes, I was watching this other one, I didn't do that. I didn't understand it until you said it this way. Because I'm the kind of person in the health, the clinician, that if I'm going to talk to people, I'm not using in big words or anything. Like, I have to make it, the person who's in seventh grade, person who's in the getting out of high school, and somebody who's doctorate, master's degree level can understand it. Because what is knowledge if you speaking it out there and you using big words like I'm speaking to my colleagues, and they can understand it? Then what's the point? And I don't see it that way. So if I broke it down as much as I could, not to dumb it down, but to make sure I respect my audience, but at the same time make sure I'm not speaking above them and not speaking below them. So it's about 41 minutes now. I said I wasn't going to talk more than 30 minutes. But thank you all for watching right now, and I hope I do this so this doesn't go, so this goes to where it needs to go, and then it's going to be published later, and then hopefully I can get it on YouTube later. Okay? So thank you all for watching. Once again, I will be coming back here. I'll try to be on every Tuesday, or maybe Friday, Tuesday and Friday. Before I go, we have an exciting show for you guys next Tuesday at 7 p.m. within collaboration with Focus on Liberia. I want to say good morning, America. Focus on Liberia. We're going to be talking about going to your doctor's office. Part 2, we'll be talking about different screening thing. I'll probably bring a little bit of breast cancer back into that too, but other screening issues that need to be done at your doctor's office. So we'll be talking about that, and hopefully the following Tuesday we'll be talking about something else. And I did mention about domestic violence. I do have a video on my page too. I couldn't share it here, and I'm trying my best to share it there too. So, but thank you all for watching. I appreciate it. And those who will be watching later, this is a more public forum now, so I'm sure I'll be getting comments from other people that I don't know. But please leave your comments and questions below, and I'll be more than happy to answer them. Okay. Thank you. Goodbye. God bless.